You're standing in the pet store aisle, or maybe you are 3 pages deep into an Amazon search, and you are looking at a wall of joint supplements all promising the same thing. Healthier joints, more mobility, a dog that moves like they're young again. Some of these bottles cost $60, $70, $80 a month. And here's the part that should make you pause. The supplement industry for pets is now worth over $4 billion annually. Independent third-party testing has found that most of those products contain the wrong doses, the wrong forms, or compounds with almost no clinical evidence behind them at all. So let us talk about what's actually real. Because if your dog is slowing down, if they hesitate at the bottom of the stairs, if they are stiff in the morning, if the joy seems to have gone out of their walk, you are not just buying a supplement, you're buying hope. And you deserve to know whether what's in that bottle can actually deliver on that promise. This video is going to walk you through the evidence, not the marketing, not the 5-star reviews written by people who have no way of knowing whether the supplement did anything. The actual clinical research, the dosing science, and the honest reality of what these products can and cannot do. We're going to cover the 3 compounds that have the strongest evidence behind them, explain exactly why they work at a biological level, show you what to look for on a label to make sure you are getting a real dose and not a token sprinkle, and then we are going to talk about the category of popular supplements that the research simply does not support, and why they keep selling anyway. If you watched the senior care video earlier this week, think of this as the companion piece. That video was about recognizing the signs. This one is about what you actually do once you see them. Let us get into it. Before we get into the specific compounds, let us talk about why this space is so confusing, because it is not an accident. The pet supplement industry in the United States is not regulated the same way pharmaceutical drugs are. A company does not have to prove their product works before they sell it to you. They do not have to prove it contains what the label says. And they definitely do not have to tell you that the dose they've included is far below the threshold used in the studies they are citing on their website. That's the game. They reference the research on the ingredient to make the product sound credible, but they use a fraction of the dose that research actually tested. And you'd have no way of knowing unless you dug into the original papers yourself. So that's exactly what we are going to do together. The 3 compounds with real clinical evidence. Let us start with the one you've probably already heard of. Number 1, glucosamine and chondroitin, and why they need to be together. Glucosamine is one of the most studied compounds in canine joint health. It's a naturally occurring amino sugar that acts as a building block for cartilage, the tissue that cushions the joints and prevents bone-on-bone contact. As dogs age, or as joints sustain repeated stress, cartilage breaks down faster than the body can rebuild it. Glucosamine supplementation helps tip that balance back toward repair. But here's what most product labels will not explain. Glucosamine works significantly better when paired with chondroitin sulfate. Chondroitin is a structural component of cartilage that helps it retain water, which is what gives cartilage its shock-absorbing properties. Without adequate hydration at the cellular level, cartilage becomes brittle and degrades faster. Chondroitin also inhibits certain enzymes that break down joint tissue. So while glucosamine feeds the rebuilding process, chondroitin slows the destruction. They work together. Products that only include one are giving you half a mechanism. Now for the dosing reality check, because this is where most products fail. Research on dogs has generally used glucosamine doses, starting at around 500 milligrams per 25 pounds of body weight per day. Many of the popular chews on the market contain 200 to 300 milligrams total, with a recommended serving of 2 chews. For a 75-pound dog, you'd need to be around 1,500 milligrams just to hit the starting threshold, and many products are delivering less than 500. You're not buying joint support at that point. You're buying a treat with a healthy-sounding label. When you are reading labels, look for glucosamine hydrochloride or glucosamine sulfate. Both are well-absorbed forms. Avoid products that list it as part of a proprietary blend without specifying amounts per serving. If they are hiding the number, there's usually a reason. Number 2, omega-3 fatty acids, specifically EPA and DHA from marine sources. This is the one that has the broadest and arguably strongest evidence base, and it is also the most misunderstood. When people hear omega-3, they often think about fish oil and assume it is mostly about coat health. And yes, omega-3s do support skin and coat condition. But for joint health specifically, the mechanism is anti-inflammatory. EPA, eicosapentaenoic acid, is the specific fatty acid that downregulates the inflammatory pathways that drive joint degradation. Chronic low-grade inflammation in the joints is one of the primary mechanisms of osteoarthritis progression in dogs. Reducing that inflammation doesn't just reduce pain, it slows the structural damage. Several well-designed studies have shown that dogs with osteoarthritis, who received therapeutic doses of omega-3 fatty acids from fish oil, showed measurable improvements in mobility, willingness to rise from rest, and owner-assessed quality of life scores compared to control groups. These weren't studies funded by supplement companies. Some of the most compelling research came out of veterinary schools looking at this from a pharmaceutical comparison standpoint. Here's the part nobody talks about, though. Dose matters enormously, and source matters. The omega-3s in flaxseed oil, ALA, have to be converted by the body into EPA and DHA, and dogs are not efficient at that conversion. The research on joint benefit is specifically tied to EPA and DHA from marine sources. Fish oil, krill oil, or algae-based oil for dogs whose owners prefer a non-fish option. If your product says omega-3, but is using plant-based sources only, it is not delivering the compound that the joint research is based on. For a 50-pound dog, therapeutic doses for joint support and research have often been in the range of 1,000 to 3,000 milligrams of combined EPA and DHA per day. Not total fish oil, but the actual EPA and DHA content. Read the label carefully. Many products list total fish oil volume, not the EPA and DHA breakdown. A 1,000 milligram fish oil capsule might only contain 300 milligrams of EPA and DHA combined. You'd need several per day to hit a therapeutic range for a medium or large dog. Speak to your vet about the specific amount appropriate for your dog's weight and condition. There are upper limits, and in dogs on certain medications, particularly blood thinners, omega-3s at high doses require oversight. Number 3, undenatured type II collagen, the newcomer with a surprisingly strong mechanism. This is the compound most people haven't heard of, and it has some of the most interesting science behind it. Undenatured type II collagen, often labeled UCII on products, works through a mechanism called oral tolerance. When a small amount of native, undenatured collagen from cartilage is ingested, it is processed by immune cells in the gut. Those immune cells then travel to joint tissue and signal the body to stop attacking its own cartilage, which is part of what's happening in inflammatory joint disease. Instead of triggering a rebuild response, UCII essentially teaches the immune system to stand down and reduce the inflammatory assault on joint tissue. Several published studies have compared UCII directly to the glucosamine and chondroitin combination in dogs, and the results have been notable. In some measures of mobility and pain response, UCII performed comparably or better at a significantly lower dose. We're talking about 40 milligrams per day in research settings. That's a tiny amount, but the mechanism doesn't require a large dose because it is working through immune modulation rather than substrate supply. The key word in the name is undenatured. Heat processing destroys the molecular structure that makes this compound work. Products that use hydrolyzed collagen or collagen peptides, common in general joint chews, are using a different form. They're not delivering the same mechanism. When you are shopping, look specifically for UCII as a labeled ingredient and verify it is included at 40 milligrams or close to it per serving. Now let us talk about the other side of this. The popular supplements that the evidence doesn't support there are a few ingredients that appear constantly in premium joint products. Heavily marketed, often the first thing called out in the product name, that have weak, inconsistent, or essentially non-existent clinical evidence in dogs specifically. Turmeric and curcumin is the biggest one. It's everywhere. And look, in human research, there is some interesting early-stage evidence for curcumin's anti-inflammatory properties. But there are two significant problems when it comes to dogs and joint health specifically. First, bioavailability. Curcumin is poorly absorbed in the gut without specific delivery mechanisms, piperine, liposomal encapsulation, or other solubility enhancers. Most pet products do not use these mechanisms. Second, the canine-specific research for joint health outcomes is thin. Thin in terms of sample size, and thin in terms of rigor. There are no large, peer-reviewed randomized controlled trials in dogs showing curcumin improves joint function outcomes at commercially available doses. What you are buying when you pay for a turmeric joint supplement is mostly the story on the packaging. MSM, methylsulfonylmethane, is another one that rides on the coattails of glucosamine and chondroitin because it often appears alongside them. MSM is a sulfur compound sometimes marketed as supporting connective tissue and reducing inflammation. The human research is limited and mixed. The canine research is nearly non-existent as a standalone. It may not be harmful. It's just not something you should be paying a premium for. Green-lipped mussel is more interesting and doesn't deserve to be fully dismissed. It does contain omega-3 fatty acids and some other compounds, but the EPA and DHA content per typical serving is far below what marine fish oil delivers, and the additional compounds beyond omega-3s do not yet have sufficient evidence to justify the cost premium over a quality fish oil. If a product contains it alongside other well-evidenced ingredients at appropriate doses, fine. As a primary joint support strategy, you are overpaying for a weak omega-3 source. How to actually evaluate a product before you buy it. Here's the practical framework. When you pick up a joint supplement, in store or online, you are looking for 4 things. 1. Are the evidence-based compounds present? Glucosamine with chondroitin, EPA and DHA from marine sources, or UCII, ideally more than one. 2. Are the doses listed per serving not hidden in a proprietary blend? If you see joint support blend, 500 mg, and it contains 5 ingredients, you have no idea how much of anything is actually in there. 3. Is there third-party testing? Look for NSF, NASC, or similar certifications on the label. This means an independent organization has verified the product contains what it claims. This doesn't guarantee efficacy, but it guarantees the dose on the label is real. 4. What's the cost per effective dose, not cost per bottle? Run the math. A cheaper bottle might require 3 times the daily serving to hit a therapeutic range, making it more expensive than a premium product with a concentrated formula. And finally, talk to your vet. Not instead of doing your own research, but in addition to it. The best outcome is when you bring informed questions to that conversation. Some dogs with advanced osteoarthritis need pharmaceutical support alongside supplementation. Some dogs have conditions where certain supplements interact with medications. Your vet is the person who can see the full picture. The goal of all of this, every dollar you spend, every label you read, is more good days. That's it. More mornings where your dog gets up without hesitation. More walks where they are pulling toward the trail instead of stopping halfway through. More years of real quality, not just quantity. If this video helped you cut through the noise on supplements, the most useful thing you can do right now is start with one thing. Look at whatever joint product you currently have, or are thinking about buying, and check those 3 criteria: the evidence-based compounds, the specific doses per serving, and whether it has third-party certification. That's it, just start there. If you are navigating a dog who's already showing signs of slowing down, the senior care video we published earlier this week is a natural next step. It covers recognizing the early signs and how to have a productive conversation with your vet. Your dog cannot read labels. That's your job. And now you know exactly what to look for. Thanks for watching. If you loved this video, scan the QR code on the screen right now to subscribe and join the Pawsome Life family. Give your dog a belly rub for us, and we will see you in the next video.